Welcome back to Fundamental Sunday. On this video, we are talking about Roles of a Nurse by the Nursing Academy. Don't forget to subscribe, share, and interact with us in the comment section below. So, a nurse is a caregiver. He or she helps clients regain health through the healing process by meeting all healthcare needs of the client, such as measures to restore physical, emotional, spiritual, and social well-being. She provides individualized nursing care for specific clients and their family. A nurse is a decision maker. Nurses use decision-making skills throughout the nursing process depending on his or her assessment of patients' needs or problems. A nurse is a client advocate. A nurse speaks for the patients and other vulnerable groups. The nurse also assists the clients and their families to interpret information from other care providers, protects clients' human and legal rights, and provides assistance in asserting those rights if need arises. A nurse is an educator. She explains to clients concepts and facts about health, demonstrates procedures, for example, self-care activities, determines the client fully understands, reinforces learning or client's behavior, and evaluates progress in learning. A nurse is a communicator. Communication is important to the nurse-client relationship. Therefore, nursing involves communication with clients and families to identify their strengths and weaknesses, their needs and their fears. With communication, it is possible for the nurse to give care, comfort, and emotional support. A nurse is a manager. As managers, nurses coordinate and delegate care responsibilities and supervise other health care workers in delivering quality nursing care. A nurse is a rehabilitator. Nurses help clients cope with lifestyle changes associated with chronic illnesses or physical impairment. For example, a nurse can assist in teaching the client on how to use physical devices, such as crutches. Counselor. In counseling, the nurse helps clients identify and clarify health problems and help them choose appropriate courses of action to solve their problem. As a counselor, the counselor is responsible for providing information, listening objectively, being supportive, caring, and trustworthy. She or he does not make decisions but helps clients reach decisions that are best for them. Collaborator. As a collaborator, the nurse works in a combined effort with all those involved in care delivery and seeing to it that mutually acceptable plans are achieved to meet the common goals. A nurse is an epidemiologist. The nurse is involved in case finding, health teaching, and tracking incident rates of an illness. For example, a nurse can follow up a case of tuberculosis in the community. A nurse is a change agent. The nurse is involved in identifying and implementing new and more effective approaches to problems. She or he empowers individuals and their families to creatively solve problems or become instrumental in creating change within a mental institution. A nurse is also a consultant. A nurse can provide expert advice to other healthcare providers as well as clients and their families. The nurse and healthcare team in the hospital. Healthcare team is a group of healthcare providers who work together for the benefit of the patient. For example, doctors, nurses, physiotherapists, nutritionists, radiographers, among others. The center of the team is the patient and the family. Therefore, nurses do not work in isolation. There are other members who are not nurses who contribute to the effective management of clients. The members of the multidisciplinary team in the hospital setup include the following: medical doctors. These are responsible for screening the patients, prescribing drugs, and carrying out both medical and surgical procedures. Laboratory technicians. They examine specimens in order to come up with the right diagnosis. Physiotherapists. They treat patients by means of physical agents such as heat, water, or exercises. For example, people who have broken their limbs may need to be assisted in learning how to walk again. Nutritionists. They provide information about diet. Nutritionists also prescribe diet which may be therapeutic. For example, a diabetic diet. Radiographers. These take and develop x-rays for diagnostic purposes. Social workers. They usually talk to patients and identify those in need with the help of the other hospital. The social worker also looks at the economical status and the general welfare of the patient. Some social workers also provide counseling. Pharmacists. The pharmacist prepares and dispenses drugs. They provide advice about drugs to clients and other members of the multidisciplinary team. Occupational therapists. They educate patients on different skills in order to rehabilitate them after injury or illness. Speech therapists. They help in rehabilitating patients who have problems with speech after an illness. So there are certain illnesses that take away speech. These people help them speak normally again. Chaplains. The chaplain provides spiritual care and support to clients. The chaplain may also provide counseling for both spiritual and social issues. The members of the multidisciplinary team interact at different levels in the provision of medical treatment. Without meaningful interaction, provision of healthcare will be compromised. Each healthcare team member should recognize and treat each other with respect. Having looked at the nurse as a member of the healthcare team in the hospital, we will look at a nurse in the community setup. So a nurse in the community setting. Nursing in community-based setting is concerned primarily with health promotion and maintenance, education and management, coordination and continuity of care within the community. Community-based nurses assess the health needs of individuals, families, and communities and help clients cope with threats to health and problems of illness. They provide services for acute and chronic conditions to individuals and families within the community. Community-based nurses are employed in a variety of settings such as in schools, industries, nursing homes, and private practices. Thank you for listening. Don't forget to subscribe, share, and leave a comment.